Hi everyone, Dr. Nemechek here. I want to talk about Avoidant Restrictive Food Intake Disorder. I've had many parents say, they aren't eating that much and we're headed into the ARFID territory as things are getting worse. And I just want to share my experience with this. First, these are some criteria, and you can have a mixture of these things, one or some of these. So, nutritional deficiencies of inadequate intake, inadequate weight gain in children, needing oral supplements to maintain health, like maybe Ensure or some vitamins, iron. There's some psychological issues that are going on. And the feeding issues are not related to like a physical disability or a mental, like they're, mental disability, like they got psychosis or something. And they don't have like bulimia or anorexia. Okay. What strikes me here is the presentations in this whole world are broken down to picky eating in childhood, and this can apply to adults as you get older, generalized anxiety disorder, gastrointestinal symptoms, some history or fear of choking or vomiting. I mean, you have fear of choking or vomiting because you had choking or vomiting. Multiple allergies and reactions to that, okay, and then other reasons. All of these, especially these four, anxiety, gastrointestinal symptoms, choking, vomiting, food allergies, these are all different problems. These aren't just like, this disorder can take these different presentations. As an internal medicine doctor, you're like, I can think of separate problems that can be addressed to fix any one of these. All right? And kind of to get to the spoiler alert, when we put kids on our protocol, whether they're called severe picky eating or ARFID, it goes away like 100% of the time. It may not go away like in 2 weeks or 2 months, but it certainly starts getting better within 2 months. And what's going on here is these kids in particular have autonomic dysfunction. Okay? They've got injury or dysfunction to the autonomic nervous system. You can have a kind of side effect phenomena to where the nervous system isn't really injured or damaged, but it's just not working correctly, or you can actually have damage there. All right? And the primary driver of this is from the gut. Now, one of the things that happens here, you get an injury to the autonomic nervous system. That's what happens when you get a concussion. All right? The things people complain of. Now, I've discussed this in past visits, past videos, the two mechanical things that happen. You can get like low brain blood pressure symptoms, fatigue, anxiety, can't focus, stuff like that. Okay? So there's anxiety. The other thing that can happen is your intestinal tract slows down. And so, now I don't show on this picture all the way up to the esophagus, but I had a recent case, tightness here, choking here, kids losing all sorts of weight. All right? Happened after a concussion. Okay? Doesn't have a restrictive food eating disorder. Person's got a brain injury they didn't recover from. Okay? A dysmotility problem. Some will choke on the food. You do that a couple times, it really scares some people, really scares some adults. Okay? And they're like kind of afraid to eat or eat anything solid. Some people, the stomach won't empty. And they're kind of nauseated and they're vomiting up food later. But the nausea, they're like, I don't want to eat, it makes me sick. Some people, they'll eat and they get cramping and the small intestine just hurts. Like, I'm not going to eat that. And children don't decode stuff well to tell you all of this. But right there, from a concussion you don't recover from, all of those symptoms can happen. Okay? You fix that autonomic damage, which is what Nemechek protocol was designed originally to do, is to lower inflammation, get the autonomics recover. All of those kind of problems will go away. Now, even if the choking stops and somebody was fearful of choking, it could take a few more months before they kind of want to give it a try again. And what happens is they realize just nothing's happening, and I think just the fear in the past fades, and then suddenly they start eating. Okay? You have a psychological overlay there for sure, but you got a physiological underpinning. Now, so you can have an unresolved concussion can do that. The other thing is bacterial overgrowth, where you have colon bacteria living in high concentrations in the small intestine. That can directly cause any of these things. Okay? If you fix that problem, sometimes these symptoms will go away within a week. Now, more commonly is you've got some built-up injuries that are in the autonomic nervous system you haven't recovered from, and it's the inflammation, and usually the big part of the inflammation is coming out of the gut here from SIBO. I would also add, in this more modern era, you have to consider, in addition to treating SIBO, you have to treat the COVID damage that I talk about in other videos. You have to treat that with glutamine. So my present approach would be, because these kids also with restrictive eating disorder, they don't just have that. They got migraines, they got some attention issues, they're kind of hyperactive. They got other neurological stuff too, every single one of them. Okay? So in this context, they're all coming from the same thing. You either have direct bacterial messaging to the brain causing this stuff, or you have an injury to the autonomic nervous system, which is not recovering because of the inflammatory release from leaky gut. And if you fix both of those, these kids will do great. Now, some people say, what about all the allergies? So when you leak in this little band of tissue that surrounds the small intestine, let's see here. Oh, I don't have it here. So in that band of tissue, right around the small intestine, when you leak into that tissue there, that's 70% of all the mast cells that are going to release. If they come in contact with anything that's foreign to the body, they're going to release histamine. You can get hives, flushing, itching. If you don't get the outward symptoms, if you're doing the blood test for food allergies, they'll all be false positives. Okay, the blood test is a horrible test for allergies, but all of that is driven by leaky gut as well. Okay, so really, give the protocol a chance. Super cheap, very safe. You start seeing some improvements. Just hang in there and look. It's not going to just like disappear. You'll start things slowly getting better. The kind of pushback will be lessening, and then pretty soon they just start eating more food. People may think I'm crazy. It is that simple. I do it all the time. Okay? All right, that's all for now. Everybody have a great day. Don't forget to hit the subscribe button. If you need some inulin, fish olive oil, you can get it at nemechekprotocol.com or get a starter pack so you can start treating your kid. Everybody, take care now. Bye.